Today's health tip: avoid hidden hunger to prevent nutrient deficiencies and food cravings. A lot of people ask me, what is hidden hunger? It is the presence of multiple micronutrient deficiencies. So you're deficient in iron, in zinc, iodine, vitamin A, for example. And this can occur without any problems with energy intake as a result of consuming an energy dense, high calorie, but nutrient poor diet, right? So unfortunately, this is quite prevalent. And we see that in aging adults, especially, they are experiencing this hidden hunger. Here's a study from Nutrients 2020, and they were looking at mineral intake and deficiencies in older adults living in the community and different institutions. And what they found was that just zinc alone, zinc deficiency was observed in 31% of community-based women and 49% of men. So just healthy older adults, were actually having a lot of zinc deficiency. There's also selenium deficiency, right? And other minerals like copper and iodine as well. So the translation from this study is that you likely have mineral deficiencies. A lot of times you hear people talking about plant-based or vegan diets. What you need to know is that vegan diets are often rich in phytates or phytic acid. Now, this is a chemical in the plants, and the plants use these chemicals to store phosphorus. Now, these chemicals are negatively charged, and so they tend to bind minerals which are positively charged. And when they do that, they prevent them from being absorbed in your gut. So they bind to those minerals in your gut, and then your body is not able to absorb them, and you can have mineral deficiencies. This is taken from WebMD, and they talk about why you should avoid phytic acid. And they say people sometimes refer to phytic acid as an anti-nutrient because it blocks the absorption of certain minerals in the body. And when you eat foods high in phytic acid, they bind to these minerals. So there's calcium, magnesium, iron, zinc, chromium, manganese, very important minerals. And now your body no longer has access to these nutrients. Now, even though we know that phytates will bind minerals, sometimes you'll see that doctors recommend foods that are high in phytates: beans, grains, seeds, nuts, legumes like lentils. Okay, so they're recommending all these things without informing their patients about phytates and how that could lead to mineral deficiency. That's because doctors don't learn about nutrition in medical school. I know most people think that we study nutrition in medical school. Usually you have 0 hours spent on nutrition, and some institutions now have up to 1 hour in the 4 years of medical school devoted to nutrition. So really, doctors know nothing about nutrition, all right? Just wanted to get that clear. Now, if you were trying to remove phytates, it's not so easy. This is looking at how to remove phytates from quinoa. And it turns out that you have to cook it and then soak it and then ferment. So if you were to soak for 12 hours, germinate for 30 hours, lacto-ferment for 16 hours, cook at 212 degrees for 25 minutes, then you would be able to remove the phytates. Quite a lot of work. So your action steps are: minimize high phytate containing foods such as beans, legumes, grains, nuts, and seeds. And supplementation may not be sufficient. It's sometimes really hard to have good absorption of those minerals, especially as you continue to eat high phytate foods. So a lot of times people will say, on a vegan diet, you just take some supplements. But remember, every time you're eating those plants, they have the phytates that are binding to the minerals in food. They're also binding to the minerals in your supplements, right? You want to prioritize green leafy vegetables to get your dose of healthy minerals. So if you have any questions, feel free to leave me a comment below, ask me a question, and I'll try to give you an answer. And you can also go to my website, vivianlowmd.com. Take care. Bye.